Hello and welcome. I'm your host, Neil Howard. So glad that you could return for another segment of Health Professional Radio. We're going to be speaking with Mr. Ben Lejfer in this segment. He's joining us here from IHD Labs for both at-home clinical tests for individuals and white label tests for brands with a range of health conditions. He's going to talk about their mission, the Diagnostics-as-a-Service, and at-home offerings. And he's also going to talk a bit about why at-home testing is so important today. Welcome to Health Professional Radio, Ben Lejfer.
Hi, Neil. Thank you.
Briefly, a bit of your professional background, if you would.
Yeah, sure. I actually came from a software background, less focused on healthcare, and we had worked with all types of companies, brands, retailers, and really focusing on their customer experience. The company was very successful. It was a great experience working there. But when I was thinking about what I wanted to do next, I kept on thinking about how we were so focused on customer experience and all these different verticals, and healthcare was, in my opinion, pretty far behind where all these other industries were. So it got me thinking, why should healthcare be different? And that kind of led me to connecting with IHD in 2022, when they were also thinking about expanding from being more of a traditional lab to thinking about the direct-to-consumer space. And so my experience, as well as the lab's 10 years of history, we came together and started building out this more customer-centric at-home testing platform, which we're talking about today.
Customer-centric at-home services. Is that the core of your mission? Your overreaching goal is to make these tests more accessible and affordable?
Yes. So even 10 years ago, when at-home testing wasn't part of IHD's necessary product roadmap, what was part of IHD's core mission from the very beginning was expanding access to care. So it started off in IHD's history was in women's health and working with many fertility and IVF centers. And that mission is just the mission of expanding access to care has just continued as we've built out this at-home testing platform.
Well, tell us about IHD's Diagnostics-as-a-Service and at-home testing offering.
Yeah, sure. So Diagnostics-as-a-Service, or as we call it DaaS. It's a suite of services that essentially enables any company, brand, digital health company to create their own at-home testing program. So in addition to the testing, which obviously is core to what we do, we also have this suite of services, which enables the company to never actually have to touch a test or touch a kit, and we handle all of the back end. So that covers the logistics, so actually building the kits, designing the kits, and shipping out the kits. It includes our technology, so our APIs to connect into our partners' technology platforms, EHR integrations, to enable us to connect wherever the clients or the providers are. And then in cases where the clients don't have necessarily a large clinical arm or they need our support, we partnered with a nationwide clinical network to enable telehealth services or add-on services wherever, in whatever capacity those partners need. So in essence, all of these enable these brands to have their own white-labeled at-home testing programs in parallel to whatever their other specialties are.
Now, are there certain diagnostics that you specialize in, or are you basically a one-stop shop for any type of brand or test that wants to do in-home diagnostics programs?
Yeah, great question. So we have about 85 tests that we can do at home today. Because of our history in women's health and fertility, we have started and been focusing on the fertility segment. So that's a lot of hormone testing, both for men and women, STI testing. And in addition to what we do on the fertility side, those 85 tests also are much broader. So it could be wellness testing. It could be testing vitamins, like I mentioned, infectious disease. We have a COVID antibody test. So yes, fertility and hormones is a big part of it, but it also spans much broader than that.
Well, briefly talk about some of the companies that you're working with. How does that relationship work to get the best possible outcome for the at-home patient?
Yeah, sure. So the way I think about it is we really have two types of partners. We have a clinical partner. So this could be a digital health company that's doing something like heart management at home or diabetes management at home, or even hormone replacement therapies, either at home or in a hybrid setting. And what we do is instead of having the patient as part of those digital health journeys have to go into a lab to get their lab testing done, what we do is we enable the digital health brand to ship a kit directly to the patient's home. They can self-collect their blood or urine or whatever it is for that particular test and ship it back directly to our lab. So they can continue receiving their complete therapy, and including the lab testing portion would be at home. So that would be the clinical situation. And then the other, what we call a non-clinical situation. And these are really very broad. It's really any type of marketplace, pharmacy, retailer that wants to connect or add on testing as part of their product suite. So one example there is a company called Lab Finder. They help patients find labs near them. And now that we're listed on their marketplace, customers also have the ability to, instead of finding a lab that they physically have to go into, they can get a portion of those labs at home and self-collected and shipped back to us in the comfort of their own home.
Well, obviously, the market opportunity is vast, but what would you say is the main factor that makes home testing so important, especially now? I mean, we've known about home tests for quite a while, but what makes them so important, desirable now?
Yeah, it's a great question. So, yeah, like you mentioned, 70% of all medical decisions are dependent on lab tests. So for patients where it's not necessarily easy to go into a lab, it might be based on their geography. It might be based on it's hard to take time off work or find childcare. So we find that at-home testing just enables more people to be able to take lab tests when they're important for them, but also making it more convenient.
Well, tell us what's next for IHD in this brand new year, and then give us a website where our listeners can learn much more.
Sure. So we're really excited about continuing to grow the tests that we have. A few examples of that: we have a partnership with the lab in Canada doing a proprietary endometriosis test that allows women to get diagnosed with endometriosis much more quickly than they would otherwise. We're looking at other types of testing like PGX testing and toxicology testing. We're continuing to evolve our technology, like I mentioned at the beginning, making it customer-centric, so making the experience of working with IHD, both for the patients but also for our partners, as easy and seamless as possible. And then we're also exploring other types of partnerships. So this could be with employers, helping them improve their wellness benefits. It could be with governments, working on population health, or it could be working with providers directly who may not even be doing virtual care and might be doing more traditional in the clinic setting, but they want to help their patients avoid an additional trip to a lab. So we're excited about new types of ways that we can introduce at-home testing to the market. And for this and a lot of other information, you can find it on our website at ihdlab.com.
Ben, thank you so much for offering us some of your time this morning. Hopefully we'll have another conversation.
Thank you very much, Neil. Appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Mr. Ben Lejfer. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.